Welcome, everyone. This is Yasmina Sisarak, your host for our third Healthy Brain Initiative webinar. Healthy Brain webinar series is presented by the HealthMatters program at the University of Illinois at Chicago in partnership with National Task Group on Intellectual Disabilities and Dementia Practices, and is funded by the Centers for Disease Control and Prevention. For today's webinar, CEUs are not offered. Each live webinar will be recorded, and we will email you once we put it up on the our YouTube channel, which is usually within a week or sooner after the webinar ends. You'll be able to download the resources available and the PowerPoint that is being presented today. For any questions, comments, please use the chat box. There's about 400 registrants for today's webinar, so it's a large group. We will take questions at the end of for about 10-15 minutes towards the end of this webinar. For today's webinar, Nutrition and Brain Health for People with Intellectual and Developmental Disabilities, the webinar will focus on the role of nutrition and brain health across the lifespan. It includes guidelines for reducing risks for Alzheimer's disease and related dementias in people with intellectual and developmental disabilities and their caregivers. I wanted to welcome our presenter, Dawna Torres Mughal. I'm going to let Dawna introduce herself because she wanted to get going with the presentation. Dawna, welcome.
Thank you. Thank you for inviting me. I'm Dawna Mughal. I'm a registered dietitian, nutritionist, an educator, teacher, and advocate at heart for people with intellectual and developmental disabilities. Thank you for joining us. Thank you for your interest. Join the crowd, join the tribe that advocates for people with intellectual and developmental disabilities. That's a short and simple introduction about my work. Thank you.
Dawna, you can feel free to get started.
Okay. To get started, I like to envision this room, a nice room with round tables. And we're sitting at the round table having a social and fun conversation. I like to do that because virtual webinar can be dry and sterile. I just finished the Special Olympics of Pennsylvania summer event, health promotion, and we screened the Special Olympics athletes using virtual. I can tell you it's very, very different. So I like to set the tone by envisioning this place. We are gathered together, talking in a fun way and in a friendly way about a topic that is close to our heart. I'm trying to move my slide. That's what I'm doing. Okay, so having set the tone and the mood for the webinar, a good question at this time is, what is brain health? It can be defined in many ways. How do we promote brain health? The definition, one definition is there that came from the Physical Activity Advisory Committee. So for the youth, brain health means brain maturation and development and academic achievement. For older adults, is to prevent dementia and cognitive impairment. And across the lifespan, which is the context of our work, it refers to cognition, anxiety, and depression, quality of sleep, and quality of life. We like to have a roadmap regarding where we are going today. And the purpose of the learning objectives is just that. Where are we going? So at the end of this webinar, participants will be able to do those things. I promise you, I won't give you a test. However, outcomes are important. So at the end of this webinar, participants should be able to name several risk factors for Alzheimer's disease and related dementia. To make it easy to pronounce, I'll use the acronym ADRD. Number 2, identify nutrients that promote brain health and their rich food sources. Number 3, explain the characteristics of a healthy diet that can help reduce risk for chronic diseases associated with ADRD. 4, explain the benefits of physical activity, sleep, and social interaction. State ways for improving these factors. 5, use goal setting as a technique for achieving healthy eating goals. In other words, after we have said this and done that, how do we translate knowledge to action? Now, culture is very important. I don't care how bright we are. If we do not know how to communicate with cultural groups, we won't be effective as nutrition educators or nutrition advocates. So this is the roadmap, and the next slide will show the content. I'll show the content, and I would read that, but the content is related to the learning outcomes. So in other words, when we have a lot to pack in 45 minutes, and there's a lot of information on this topic, a lot of research, but we have only 45 minutes to pack the content. So this is the brain. How do we promote brain health? How do we maintain good brain health? There are many pillars. And the concept here is that we have to have a big picture, looking at all the factors that help the brain remain healthy. Stay active, we'll talk about that today. Eating well, sleep well, exercise your brain, connect with friends and family. We have lost that during the pandemic. We need to reclaim that. Relax and reduce the stress. It's easier said than done. It's important to do that because that can help relax us and help the brain. Control risk factors, very, very important. Diabetes, hypertension, obesity, and depression are strong risk factors for ADRD. Going back to the business of risk factors, this chart shows the risk factors for dementia. One concept, there are factors that we can change and factors that we cannot. We cannot change advancing age. All of us will grow old, and if we live long enough, we'll be in the old category. We cannot change our genetics. We cannot change our family history. Down syndrome, people with Down syndrome develop dementia earlier compared to their counterparts without Down syndrome. However, the factors that are on the lighter panel, we can change that. Atherosclerosis, we can change it. Diabetes, hypertension, obesity, we can. Inactivity, we can. And all of that, I won't read the items on the slide, although we are recorded. But the idea is that there are things that we can change and there are things that we cannot. So we work with the things that we can change. Why nutrition? One of the pillars is nutrition. Why nutrition? And the concepts are listed there that nutrition, the next slides will show the importance of nutrition, but right now, nutrition can influence our risk for developing dementia and our chances for living well with dementia. And from the standpoint of a registered dietitian, having worked in the clinical area, I would like to emphasize that it's very important to intervene early with people with IDD who have malnutrition, prevent weight loss. It is a sign of malnutrition, and prevent malnutrition by working in interdisciplinary way, the teamwork approach, because it's very difficult to reverse malnutrition in people with complicated or complex situation. The individuals with IDD have these common health issues: epilepsy, obesity, a long list of health issues. And these are documented in the literature. And my list of resources and references will show the references that I have used in collecting this information. Many issues, immobility. And as I mentioned, although we are recorded, I won't read the information on the slides. You can read them yourselves. But throughout all of this, nutrition is related. They are related to nutrition. The prevention and treatment are related to nutrition. Nutrition, lifespan approach. I have this wonderful sentence, nutrition from womb to the tomb. What happens in the womb of the mom, the health of the mom, affects the health of that baby. When that baby is born, and the health of the baby at infancy will affect the quality of health throughout the life course to the tomb, which is the aging piece. And I really like to use that concept because nutrition is very, very important from the beginning through the life course, different stages of life to the tomb. So keep that in mind when we are talking about nutrition, or when you are talking about nutrition with anybody, or you are a caregiver or a family member. And if you're young and expect to be a mom, make sure that you're taking care of your nutrition early in life. Key principles, we'll be talking about, everybody has a favorite diet. There are so many diets out there, many, many diets. I just reviewed the literature, there are many diets. However, I like to summarize the many diets into major principles. That diet is not the only factor that affect health, many other factors. However, diet and nutrition are a strong determinant of health. And people need the same nutrients, but the amount will vary according to individual needs, meaning young people will need more calories, will need more protein compared to the older one. Older people may need more calcium and vitamin D compared to younger one. And look at the diet, the total diet over time, and not nutrient by nutrient or food by food. And as I mentioned already, and I'll repeat it, other factors affect brain health. And don't forget the social determinants of health. They are often ignored or neglected. They are really part of an important assessment. And from my review of the literature, it is very clear that many clinicians forget the social determinants of health that are important to assess. Why nutrition? Nutrients nourish the brain. The brain is very active. Metabolism is very active. It requires a lot of fuel, and the food delivers the fuel, carbohydrate, glucose for the brain, and protein. Proteins produce energy. You do not want to use protein for energy purposes. Lipids produce a lot of calories, 9 calories per gram, that will be shown in this other slide, vitamins and minerals. In other words, all the classes of nutrients, 5 of them plus water, that is the 6th one, they work together and not in silos. So it's very important to look at the nutrients working together, helping one another, rather than working alone. Malnutrition, the literature shows, I'm very familiar with the literature, I'm buried in the literature regarding brain health and dementia, that malnutrition affects brain structure and function throughout the life course. The first 1,000 days, you have heard already, are very important to the health of the fetus in the womb. And don't forget about the microbiome. The microbiome of the mom talks with the microbiome of the baby. I mentioned the 3 macronutrients. The macronutrients, the carbohydrate, protein, and lipids, they provide fuel, and carbohydrates are the major source of fuel, meaning they give you instant energy. Therefore, they constitute a major portion of the calories. I know there are controversies regarding about the level of carbohydrate in the diet. This is taken from the USDA dietary guidelines. I do not like to use numbers most of the time when I teach. I've been teaching for many years. I taught for more than 35 years in the classroom, college level, all kinds of nutrition courses. And when I teach, I usually avoid numbers because numbers can be very confusing. But what the slide shows is that carbohydrate constitutes the major proportion of the calories, 45 to 65, protein 10 to 35% of the total calories, and lipids 20 to 35%. And some people will argue because some diets do not allow a lot of carbohydrate. And later I will talk about the different diets that the American Diabetes Association reviewed and showed that diets can work, different diets can work. But the idea of a range is that they can be individualized. They can be adjusted to individual needs of the person that we care for. Vitamins do not yield energy. They're small and they are needed in small amounts. So the carbohydrate, the protein, the fat, obviously. And if you have taken nutrition courses, this should be a review to you. And I like to repeat that vitamins and minerals do not yield energy. They do not give calories. However, they have important functions in the body. There are many vitamins fat-soluble, water-soluble, and the minerals. There are many of them. What I would like to point out in this slide is that if you click on the two links at the bottom, that will take you to details regarding the vitamins and minerals. Wonderful resource. And I believe I listed that in the list of references. In other words, we cannot cover many things in 45 minutes. However, if you click on the links that I have provided, the links will take you to the details if you're really interested in the details. Thiamine, riboflavin, niacin, vitamin B12, folate. When I teach minerals and vitamins, the students cover their ears because there are so many and they're so confusing and the functions are interrelated and the numbers are there. They have to know the RDA, and I do not like to say that in a setting like this because there are so many numbers. Nutrition has many numbers. Vitamins, this is a repeat. I don't know why that is repeated. Let's see. Okay, minerals. Water. Okay, water is the sixth class of nutrients. We can live longer without food than we can without water. Very, very important. We take water for granted. It acts as a solvent. Vitamins and minerals and carbohydrates, all the nutrients we have mentioned will not function without being dissolved in water. They have to be dissolved in water in order to function. They transport the medication, they transport the nutrients in the body. So without water, circulation of these vital materials will be blocked or impaired. Waste products, we go to the bathroom, urination, the waste products and products of metabolism are excreted by water. Regulate body temperature. I do not know where you live. Right now it's very hot where I live. And it maintains, so drinking water will maintain my body temperature, maintain my normal fluid and electrolyte balance. I can tell you as a clinician, we always look at the fluid and electrolyte balance of the patient's chart because imbalance can be life-threatening. And it maintains normal blood pressure. If you do not have enough of water in your body, your blood pressure can go low. That can affect the heart. That can affect the kidneys. So look at the water really as physiologically important ingredient in the recipe for good health. Nutritional factors, I'll look at the folate and vitamin B12, and I'm conscious of the time, so because as I said, there's a lot of information. I did not even mention iodine. I did not mention iron because of so much material, but iodine and iron deficiency are worldwide problem. Iron deficiency affects growth and development and affects learning. Iron deficiency affects growth and development and learning. I am not even mentioning that simply because of the time that we have. So, but anyway, to review, folate and later vitamin B12, B12 is the cobalamin, is the other name for they work together in the body, and together or singly, they affect neurological health. You are familiar with neural tube defect, NTD. An example of that is spina bifida, showing the child shows the spina bifida, the spinal cord is not developed. Anencephaly means without brain, and the child with anencephaly doesn't live very long. So very important, and there are some more slides that will show the importance of these vitamins. B vitamins to continue. It's very confusing. The research the results are inconsistent, and we can expect that because of the differences in methods. That is one of the issues in AD research, meaning that the methods are inconsistent, the outcome measures are different, and therefore it's difficult to compare results. But in summary, the volumes of research that I have in my file, the conclusion of this author is that there's insufficient evidence for association with cognitive decline or dementia. And the chemistry is that when you have folate deficiency, your homocysteine blood level will increase because you need folate to properly change homocysteine into another form, because homocysteine that is high in the blood is believed to damage the neuron cells, causing tau or amyloid formation, And then it can also damage the arteries, causing atherosclerosis. And atherosclerosis, as we mentioned before, is a risk factor for a dementia. So the conclusion there of the people who reviewed research is that there is insufficient evidence to support an association between these vitamins and cognitive decline. Okay, folate, DNA, and red blood cell and protein. I always call them the growth promoting nutrients. They are responsible for making the DNA, the red blood cell, and deficiency in vitamin B12 cause peripheral neuropathy, the tingling, the sensation in your limbs. Megaloblastic anemia is a good sign of the vitamin deficiency. The cells are large. Macrocytic is a term for it. They're immature, they're young, therefore they do not function properly. And the clinician should be able to differentiate the red blood cells appearance from the appearance of the red blood cells and iron deficiency anemia. In addition, people feel fatigue and cognitive impairment. The issue with this vitamin is that the blood levels do not really accurately reflect the adequacy of the person's status in vitamin B12. In other words, there are issues and laboratory measures of these vitamins. Okay, vitamin B12 occurs only in animal products. So that's one thing that we advise people who eat a vegan or vegetarian diet, that if they do not eat animal foods, they are high risk for vitamin B12 deficiency. The good news, however, is that the body stores vitamin B12 for a long time, and exercise is economy, so it takes a long time for the deficiency to develop. Now, related to the aging population, when people grow older, their intrinsic factor, the stomach secretion decreases. So the intrinsic factor in the stomach acid, hydrochloric acid, the secretion is reduced, and therefore the absorption of vitamin B12 is reduced or impaired. Vitamin B12 needs intrinsic factor, needs hydrochloric acid in order to be absorbed, and guess where? It is absorbed in the last part of the small intestine. We call it ileum in medical jargon. And the term for that in the medical lexicon is atrophic gastritis in older adults. It's more due to absorption compared to dietary intake, which is the primary deficiency. Numbers, here we go. I like to show the numbers to show you that we really need a very small amount in micrograms, not even in milligrams. And it's very difficult for older adults to meet their vitamin B12. If it is, then we do recommend synthetic vitamin B12 supplement or foods that are fortified with vitamin B12. There are many foods that are fortified with vitamin B12 nowadays, and we also advise people who eat a vegan diet or vegetarian, very little meat product, to eat foods that are fortified with vitamin B12. Okay, important, niacin. I did not even mention niacin earlier. Niacin is very, very interesting. People died of pellagra in the old days. In the South, they ate a lot of corn and they developed pellagra. So when I teach this, I say the 3Ds, dermatitis, symmetrical dermatitis. You look at the hands of that person, you can see that the palm, one palm and the other palm, they look similar because the effect on the palm is symmetrical, and people have diarrhea. The whole GI tract is inflamed, and people have diarrhea and they develop dementia. And the last D that I did not include there is death. But a study by Morris, if you can read the slide, and I can't, the study by Morris in 2004 followed up 3,718 participants, a 5-year period. And her conclusion in this interesting article is that dietary niacin intake reduces the risk for cognitive decline annually. So, but that was done in 2004. And I mentioned again and again, it's really very difficult to isolate the result of only one vitamin in an population study. So just keep in mind that I'm glad that we do not see pellagra anymore. because people can die from pellagra. Okay, the other theory is inflammation. Inflammation is a big disease-causing agent, and the theory is that the brain is prone to oxidative stress and damage because the brain has a lot of fat. So the oxidative damage can cause inflammation of the neuron, and then the inflammation can cause AD or contribute to AD. But the literature uses the word cause at the molecular level. And there are other theories out there, a lot of technical stuff in the literature, your mitochondria, the powerhouse of your cell, dysfunction, then the production of neurotransmitters is affected. And so what do we need? Antioxidant nutrients, theoretically. Antioxidant nutrients can stop the peroxidation of the lipids or the free radicals that are produced every day that we live. The antioxidants can help trap the free radicals and can stop the damage that free radicals do to the cells. So these are the antioxidant nutrients. When we talk about antioxidants, we like to talk about a system, the whole, not vitamin C, not vitamin E, not selenium. There's beta carotene, but we look at the system. The system is made up of many nutrients. And here I listed vitamin C, translating that to food. Your red and green peppers, if you like them, they're very good sources of vitamin C. Broccoli, strawberries are in season, wonderful. Cheaper and better quality. And the numbers there, the RDA, you can see that the men need more than the women. And people are taking 500 milligrams a day or 1,000 milligrams a day, hoping to cure or prevent COVID. You know that. Vitamin E, very small amount. I like to mention that vitamin A comes from oil. So one of the benefits of oils or fats in our diet is that they are a good source of vitamin E. So vegetable oil, some people add wheat germ to their cereal, some people like sunflower seeds, nuts, peanuts, hazelnuts. The idea is translating the nutrient to food sources. People do not eat nutrients, they eat food. So when you talk about nutrients, translate them to food. And at the bottom, I think there is selenium, right? Selenium is a mineral, and together, the other parts of the system are not there. Okay, the omega, they're mouthful. Omega-3 fatty acids, there are 3 of them. They're long polyunsaturated fatty acids. And the other contribution of lipids in our diet is that they provide the essential fatty acids. One essential fatty acid is linolenic. When you read the food, if you pick up a food that claims it has omega-3, you look at that and it will say ALA. Do consumers stop and say, what is ALA? ALA stands for alpha-linolenic, and that omega-3 is present primarily in plants. Then you have the more polyunsaturated fatty acids at the bottom. There are eicosapentaenoic acid, or EPA, and docosahexaenoic acid, or DHA, and they come primarily from marine oils. So the salmon, the tuna, sardines, herrings, and all the fatty fish are very high in omega-3. DHA is abundant in the brain. It is an omega-3 that is present in the brain. I have seen formulas before for babies that are fortified or have added DHA, and the idea is to help the brain of the baby grow. Okay, fish and fatty acids. Maybe I just read an article. It's more recent than the one that I'm showing you. That the consumption of omega-3 is lower the triglycerides, lower the blood pressure, and so indirectly it can benefit the brain, because if you lower the blood pressure, if you reduce hypertension, reduce blood triglyceride, and you can reduce inflammation, then that can benefit the brain, because the hypertension and atherosclerosis are risk factors for heart disease. But the literature points out that to get them from food is better compared to supplementation, but the number is there in case you're interested in number. 1.6 clinicians usually know the numbers. So the conclusion, evidence on beneficial effect is conflicting, but the protective role, meaning if you are okay, the protective role does not exist. But the evidence is there, but the results are inconsistent. So that is the problem. Okay, a simple sentence is a clean heart is good for the brain. In other words, the heart diseases, heart health is connected to brain health. If you have congestive heart failure, if you have blocked arteries, if you have hypertension, that can damage the heart, and the heart pumps the blood, and circulation to the brain is impaired, and that can damage the brain. The heart, the lungs, and the kidneys work together, and they all affect the brain. So a clean heart sounds simple. A clean heart helps the brain. A clean heart is good for the brain. Okay, the therapy. There is a reference in my list, and that has this article, and I suggest that you read it, because the American Diabetes Association compared all the diets that I have shown there. And, the Mediterranean, the low fat, very low fat, low carb, very low carb. And people nowadays are very interested in low carb diet and very low carb diet. There's a lot of numbers in that reference, and we do not have time to do that. In summary, the low carb, and I'm not a proponent of low carbohydrate diet. I am presenting the result, not to show that I endorse it, but the low carbohydrate diet and the very low carbohydrate diet show the reduction of A1C or hemoglobin A1C, lowering of blood pressure, lowering of blood triglyceride, increasing the good cholesterol, which is your HDL, and also, I can't remember the other one, but anyway, the results are good. In other words, for some people, it is a good option, and they have to work with a clinician who knows how to do it. So please use that article, because it has a chart, and it compares these different diets that I have shown on the screen, and the comparison shows the benefits of each type of diet. But the conclusion this is a consensus, a position statement. The conclusion is that the diets will fit if they are individualized to the person, emphasize non-starchy vegetables, and limit the sugar, the added sugar, and also minimize the highly processed foods. Choose whole food versus the highly processed food. So please use that reference, because it has like 20 pages, and I just chose the one I just want to show you that without going over the numbers. I'm looking for the arrow. Okay, so nutrition, from the nutrients to the foods. Look at the plate, and it's summary there. It's easy to remember, I think. And if you do it, it becomes easier. Offer vegetables. Vegetables are low in fat, high in fiber, packed with vitamins and minerals, and they are in season. Fruits are in season, the same. And the fruits are high in sugar, so you want to don't drink your calories. In other words, you want to make sure that you're eating the proper amount. Whole grains, make sure that half of your grain selection are whole grains. Low fat or fat-free dairy products. Lean protein foods, and adequate fluids. So this is really the conclusion of including Alzheimer's Association and including the dietary guidelines for Americans. So, and this has been in the books. These are not new, but the food rather than the numbers. Okay, that came from the dietary guidelines for Americans. Again, you have the different food groups there. You have different choices within each group, and therefore you can create a diet that suits your cultural preferences, your resources, availability of the food. It's really very flexible. The idea is tailoring a diet that best meets your need, and each one all the diets that I have shown you, except the paleo. I listed the paleo there. The review of that is not really favorable. Okay, benefits. This is a busy slide, and I won't go over this. This came from the Physical Activity Advisory Committee. In fact, this is a slide from that group. I just copied it. I copied it instead of listing all of that. The idea is that physical activity has many benefits for adults and older adults. So, but then how do you do it? That is the question. How do you start? How do you maintain it? And these are really the question. And there is a campaign, there's a MOVE campaign endorsed and developed by the Physical Activity Committee government in order to help people become less active. And sleep, okay, I learned something new. I learned something about lymphatic system. That system is like a garbage disposal, meaning when you sleep, the garbage disposal for the brain works. So the garbage collector comes during the night and removes the waste product left by the brain. So this allows the brain to function normally the next day when one wakes up. So going to sleep allows the brain to get rid of its garbage. So when you wake up the following day, it's re-energized and ready to work again. How much sleep? 7 to 8. You can do a self-assessment. Do you sleep 7 to 8 hours a day or at night? And the question that Beth asked me, how do you do that? When Beth Marks invited me to do this webinar, the question is, how do you do that, right? And so you go to bed and wake up at night. Again, do self-assessment. What are you doing that helps you sleep better? What do you do? Rather than my telling people to tell you, what do you do that helps you sleep? But sleep is very important. So however you do to help you go to bed and have a deep quality sleep, keep doing that, because sleep is like a garbage collector. It collects the garbage at night. And when the brain wakes up in the morning, it's re-energized and clean and ready to work again. Okay, social relationship. We have to reclaim it. We lost it during the pandemic. Our social connection with our friends and family. I haven't seen my daughter in many months because of this lockdown, but very important for people with intellectual disabilities, for anybody actually. And how do you engage people nowadays? Are they ready to do that social connection? But these are the benefits of I like that first, the text in the beginning, influences of social relationships on the risk of death are comparable with well-established risk factors for mortality, such as smoking and alcohol consumption, and exceed the influence of other risk factors, such as physical inactivity and obesity. Loneliness is a risk factor for malnutrition. Loneliness, isolation are risk factors for malnutrition. When we assess patients, we look at housing and we look at social support, because these factors help people maintain emotional health, mental health, and physical health as well. So very important. Okay, culture, very important. What is culture? There's an academic definition there. And what it encompasses: language, communication, how I talk. FYI, I'm from the Philippines originally, so you can hear the accent, right? My communication style is very different because of my cultural background, the values of people, really. And this refers to all people that we are dealing with, how we view the world, our attitudes about our health. My perception of health and disease and illness will be affected by my culture. And when you communicate with people, they have different styles of communication. My expression of emotion, some people are direct and some people are indirect. And we have to respect that. And then the willingness of information for disclosure. Some people are willing to disclose personal or family information to strangers, and some people aren't. And so we need to respect the hesitancy or the unwillingness to tell us the to tell us the personal information that they have. Gender roles, very important. We have gender roles in our communication. Women are expected to do certain things, communicate certain way. Again, that's very cultural. And perception of time. I joke that when you come to the Philippines, when you invite people for 4 o'clock time, they may come at 5. So you tell them come at, you tell them, oh, we'll meet at 3, because the perception of time is very different. And I studied a course in intercultural communication. It's very interesting how people's perception of time is very different. Some people want to be on time, and some people culturally will come late. And then also the language, avoid misinterpretation of your language, using metaphors, slangs. You can be misunderstood, so use plain language, use that people can easily understand. And these are I'm sure you are doing this already. And instead of judgment, use observation. Okay, some tips for body movements. Eye contact, some people look at you directly and some people avoid it. It doesn't mean they're not interested, but it can mean respect for you. Physical space, we have comfort zone. Hey, you're standing close to me. Some people don't like that, and others are huggers. They hug you, close body contact, and some people don't look like that. And then perception of time, I covered that already. I think my slides. Okay, from knowledge to action, right? So we have said all of this. Now what do we do from knowledge to action? So there are different learning theories that we study, we use to help us understand and motivate people to achieve desired behavior changes, self-efficacy, social learning theory, cognitive behavioral theory, goal setting. And again, Beth Mark said something about medical model, and it should not be medical model when we work with patients. It should not be biomedical model. There's more to health than biomedicine. There's a lot of social factors, environmental factors that affect health, and the person is in the center of the model, and he or she is responsible for the decision, and if the person isn't able to do so, assisted decision-making process is important. Balancing the risk with promoting the person's autonomy and independence. Okay, this is SMART goal. SMART, the goal should be specific, measurable, attainable, achievable, realistic, and time-bound. So, and I'll show you an example of that, but this is an acronym for writing specific. This theory was done by Locke, L-O-C-K-E, and there are different learning theories, however, and I'm using this because it's kind of specific and simple to use for this webinar. So this is an example of a goal. I will increase my fiber intake by eating 1 more serving of vegetables and 1 meal each day. This is a SMART goal. 1, it is specific. It has an outcome measure that I observe and measure. It is achievable, meaning if it's based on the assessment of my ability and resources, I can achieve it. It is realistic, again, if it's based on assessment of my ability and resources. Time-bound each day. So it specifies each day. That is time-bound. Now you can see that the other 2 goals on the right panel, my right panel, are not SMART. They're not smart because they're too general. I will increase my fiber intake. How much, when? I will drink less sugar sweetened beverages. In other words, when we work with people using goal setting, we help them form or write SMART goals. But it's only one of the theories, and I believe that behavior changes involve different theories that are combined. Summary, brain health has several pillars. Healthy eating is one of them. Good nutrition is good for the brain. I've said that many times. No one diet fits all. We know that. Your favorite diet may not be mine. What works for you may not work for me. And the big word there is individualized. So it's person's needs and preferences. And that means good self-assessment. Assessment drives the plan. Nutrients are interrelated and working together in the body. And no one single food or nutrient can deliver the benefits of the whole. I mentioned already vitamin B12 and folate. They work together. Without folate, without vitamin B12, folate cannot function properly. They have to be together in order for the outcome to happen, meaning the red blood cell synthesis and the growth promotion. Summary to continue, healthy eating. Again, looking at the big picture now, circling back to the beginning, the pillars, healthy eating, physical activity, smoking cessation, alcohol use, rest and sleep, controlling the risk factors that we have repeated many times already. So circling back to the beginning. Okay. We're ready for the questions.
Thank you so much, Dawna. As a reminder, we will post the recording, PowerPoints, and the resources that Dawna has provided to us on our YouTube channel, and you will be emailed within a week of today's webinar. So Deb, yes, you will have access to the slides. I just wanted to just kind of talk a little bit about this nutrition presentation is the very first one of sort of a series of nutrition presentations that we will be offering for the next 4 years during our CDC funding. So stay tuned. Our hope is to bring also some, even thinking through some practical advice on even grocery shopping and preparing meals, etc. So stay tuned on some of those topics to come. We will take we will take questions via chat. So feel free to post your questions in the chat, and I will ask them of Dawna. While there were a couple of questions that came through, and one is, can malnourished people be obese or overweight? So basically a definition of malnourishment.
I cannot hear that very well. Can you repeat that, please?
Oh,
there's echo in my room. This room has.
Can malnourished people be overweight or obese?
Can they be overweight?
Yeah. Can you be malnourished and be overweight or obese? Because we oftentimes talk about malnourishment is for people who are usually underweight, but the point is malnourishment can happen also when you're overweight or obese. So that was a question for you to comment on.
Well, in other words, overweight people, can they be healthy while still overweight?
No, can they be malnourished?
Oh, yeah. In fact, I'm sorry. Thank you very much. My room has a lot of echo. This is in the library. Thank you for repeating the question. Malnutrition includes both undernutrition and overnutrition. So in other words, larger body size and obesity, if you want to use the word, is also a form of malnutrition. That's a very good question. And yes, the answer is yes. And there's a term sarcopenia, that people can be overweight but protein deficient. And you cannot see the sarcopenia because the body size is big. So you think the person is okay in terms of protein status, but they're not. So, but this is a very good question because, as I said, that's one of the slides that I omitted to reduce the amount of the presentation today. Thank you. So as I said, the room has echo here. So thank you for repeating that.
So I can also put the question in the chat box privately to you so you can read them if you're having a hard time hearing me, but I will still read them out for the rest of the audience. If you spend years eating poorly, can you regain better brain health if you change your eating habits? How much time does one have to improve their health?
How much time can people stand? I mean, how much time will you have to do in order to improve the brain health? Is that the question? How much time?
Yes.
Yeah.
So
That is a very interesting question. It it depends on what you mean by health. I mean health in terms of heart disease, in terms of brain health. What kind of brain health are we talking about? Depression. Uh, in terms, I guess I would like to cite something more specific, like hypertension. Correct? How much time do I have to modify my behaviors, my eating behaviors, and lifestyle behaviors in order to reduce my blood pressure? The literature shows that if people lose weight, like even 5 to 10% in 6 months, the blood pressure can go down, the blood glucose value can go down. In other words, weight loss can produce the results in terms of A1C, hemoglobin A1C, or blood pressure. So I like to use some specific example and say that within 6 months, if people lose 5 to 10% of their baseline weight, if they have extra body weight, that can produce the results already, like lowering of the A1C, hemoglobin A1C, lowering of the blood pressure, and feeling much better. So I can answer that by using specific examples. And the same thing with blood glucose, according to the literature, weight loss is the key in controlling these laboratory values that we look at as outcome measures in certain diseases. And the literature shows that. The literature that I cited, the position of the American Diabetes Association shows all the details there. But yeah, but you're asking good question, and thank you for that.
So I mean, the simple answer is you can change your health outcomes by starting to eat healthier today and maintaining that healthier lifestyle. As even if you're in your 40s, 50s, 60s, people can make a difference. I'm
Right.
getting a lot of questions, so I will move on. But before I move on, I just wanted to, a couple of you have asked, are there any resources for individuals with IDD to learn about how nutrition improves brain health? So Dawna, you can answer that, but I also wanted to talk really briefly about the Virtual Coach Health Matters program. Some of you are familiar with it. We are offering another set of, we have opened it for additional organizations to join us in September. I have added the website link to it. Oops, sorry, to everyone. So you can see the link and you can see the information. The informational webinar is in August 3rd. We have added healthy brain messaging throughout our program. If you're interested in joining the program, it is free, but it is a behavior change program specific for individuals with intellectual disabilities, and it's also an ACL approved program. So just putting that, it is part of Healthy Brain Initiative CDC funding. So I'm just putting that out there before people start signing off. All right. Next question is, what lab values should be monitored to assess nutrition?
What lab values?
Yes.
Okay, that's a good question. What lab values are you looking at? It depends on again, it depends on situation. Are we talking about a sick person? Because albumin is out of the door. We don't look at albumin. Are we talking about anemia? Then I look at hemoglobin, hematocrit, or your doctor will look at that. Are we talking about osteoporosis? The doctor will look at my PTH, parathyroid hormone, if it's excessive. The doctor will look at my vitamin D level, my calcium level. There is telopeptide, the doctor will look at that. So it's in the context of a specific disease. In terms of protein nutrition, I look at the weight. I look at the weight because weight loss is really a sign of illness or poor health. If I look at the weight and there's unplanned weight loss, I have to look at what causes the weight loss. So going back to the lab values, it depends upon the situation. So protein deficiency or iron deficiency, and if I look at the size of the cells, if it's big, it could be B12 or folate deficiency. If it's small, it can be an iron deficiency because the red blood cells will look different. due to this different anemia, different forms of deficiency. So yeah, thank you for asking that. And yeah, I try to answer it by citing specific information, and I can disclose that my doctor looks at my calcium, my vitamin D value, my PTH, because I'm small, and then that I may have osteopenia or osteoporosis. So he follows up on that. If I have diabetes, he will look at my hemoglobin and my A1C, right? And then he will look at the HDL, look at LDL, because these are triglyceride, blood triglyceride, because these are signs of blood lipid abnormalities that can lead to blockage of the arteries that is a risk factor for dementia.
Thank you. Any comments on probiotics, gut-brain axis, and any words of wisdom on that?
Any comments about what?
Probiotics.
Probiotic, that
Yes.
is a big field. The material is probiotic, the microbiome, that is really a big area, the microbiome and the brain, meaning there's a connection between your gut microbiome and the brain, and the diet affects the gut microbiome and the brain, and the research is enormous. We do not really know the connection, but I know that from the literature that the what we eat affects the health of the microbiota, and microbiota affects the health of the brain. My suggestion is it depends upon the probiotic that you are buying or prebiotic. Okay, make sure that you buy it from the regular, a reliable vendor, because they may not have live bacteria. But the other way of doing it is to eat food that will feed the gut microbiome in a good way. So your fiber-rich foods, for example, are good food for your microbiota, and that can help them grow. So again, it's a big field, and the research is there. No matter how many times I attend a session, it still confuses me because there's so much. I hope I have answered that question, but it's a big field. We keep learning. We do not know the answers. And gut microbiome is related to many diseases, diabetes, Alzheimer's, dementia, GI problems, and many others. So stay tuned. It's a good question, and it's a good topic.
Thank you. Next question. When people have diet restrictions, how would they make sure to get all the nutrients that they need?
Again, you're really asking a question. When you have diet restriction, as a rule, when you reduce your calories, you're reducing your nutrient intake. That's a rule. When people are restricting their diet, eating smaller amounts, like even 1,000 calories, 1,200, and then the books before would recommend a supplement if you're eating really a restricted diet, like 1,200 calories. You may not get enough of the nutrients that you need. So that's a good question. So, I call it make sure that every bite counts. Make sure that every bite that you eat has a lot of nutrients. Will I eat a donut instead of an egg? Okay. If I eat an egg, that has more nutrients than a donut. So, but that is really a good question. The general rule to remember, how do you do it? Again, a supplement may be in order, and the doctor may not. I'm biased. I'm a dietitian, but many dietitians will look at the calorie level and say that you're not getting enough of this or that. So I would say that maybe vitamin calcium may be a problem if you're not drinking dairy. Calcium will be a problem because your dairy is a dependable source of calcium. Vitamin D, you can get that from the sun. You can get that from vitamin D and calcium fortified foods. You can do that. So, but yeah, how making sure that every bite counts. Nutrient
And
dense.
I think we have just one more minute for one last question. Regarding lymphatic system, are there any findings specifically for people with developmental disabilities, autism, Down syndrome, and the lymphatic system?
Okay, say that again, please.
Are there any findings specifically for people with developmental disabilities, Down syndrome, or autism, and the lymphatic system?
Any findings regarding the diet or regarding anything?
Regarding lymphatic system.
Okay, I see Matt on the panel. Maybe Matt can share. Can Matt talk?
Yes, Matt can get unmuted and talk.
Can you hear me? I'm not sure what the question is also, the lymphatic. You mean lymphatic system? I'm not an expert in nutrition, so maybe you could spell it and then type it into the text box.
Sure, I will do that. It's the waste clearance pathway in the brain. In a place
The lymphatic system,
yes.
right?
Yes.
The lymphatic system, that is the new thing from it's not new, it's old, from the NIH. The lymphatic system, everybody should have that. And I don't know what would prevent it from working in certain groups of people, because it is a system. You have glial cells. The term came from the combination of lymphatic system. We all have lymphatic system, and the glial cells, the brain have glial cells, the neuron. So the two are present there. So why should it be different in people with Down syndrome? Because all of us have lymphatic system, we have glial cells, and the word lymphatic is a combination of glial cells and lymphatic system. I don't know if it's any different for people with Down syndrome.
Dawna, I've never seen anything in the literature that looks at differences in it.
I did a quick search on a scholar, and I have not found any research.
Yeah.
But I just did it quickly to see if there's anything.
Yeah. Yeah.
Oh, go ahead. All right, so we're at the time. So I wanted to again thank our presenter. Thank you so much. And please feel free to contact us if you have any questions. Like I said, we will share all the recordings and resources available. Have a great rest of the day, and thank you so much. And thank you, Dawna, for presenting. This was super informational and interesting.
Thank you. It's a lot to pack in 45 minutes.
It is. That's why we're going to parse it out and start kind of we will have develop a sort of a topical areas that are related to nutrition. There is a lot to unpack.
And thank you for the questions there. Yeah, they cause us to think.
Thank you. I will,
Thank you.
we're receiving lots of thank yous, and I will stop the recording and feel free to sign off.
Thank you.